Hello again, everyone. My name is Marty Guthmiller. I'm CEO at Orange City Area Health System, and I'm presenting to you today the 18th version or edition of the COVID-19 community briefing. What I want to do today is give you some of the stuff that I've normally provided for you, but then step through kind of where we're at locally, where we're at county-wise, where we're at regionally, with the 20 counties in Region 3 that we're a part of, and then also some information at the state level. So it's a little bit numeric today, a little bit statistical, but I think of value, and hopefully it gives you some direction and perhaps even some assurance. First of all, locally, we've conducted 96 tests as of this taping. 7 of those tests were positive. 88 of those tests were negative, and there is 1 test currently pending. We have had a hospitalization rate of those 7 positive of 4 people. 4 of those 7 were hospitalized. 1 basically overnight, 3 for a longer period of time. But as we look at hospitalizations throughout the various tiers that I'm going to talk about, we need to be careful because hospitalizations are not the same from rural to urban, or even from urban to urban. For example, hospitalizations in Sioux Falls were significantly lower than the hospitalization rate in Sioux City. Again, it's not a matter of right or wrong, this is a matter of different medical staff approach, philosophy, aggressiveness, passiveness, or whatever. And so we have to be careful with that. We will see our local numbers go up in terms of testing. We hope not positives, but in total tests, we will clearly go up because we will be testing many, if not all, of our same-day surgery procedures, our non-essential, so to speak, surgeries and procedures, as well as our OB patients. So those numbers will go up, and we'll talk about that a little bit more. Sioux County, as of last evening, the latest numbers that I have announced 4 additional cases yesterday, bringing the total number of cases in Sioux County, total positive cases, to 96. Of the 4 positives yesterday, all 4 are self-isolating. To my knowledge, and I've checked around a little bit on this, there are no hospitalizations in Sioux County currently. So all people affected, particularly within the last week, we've had 50 or so new cases. To my knowledge, none of those new cases required hospitalization, and folks are self-isolating at home or elsewhere. Region 3 is the next level up, and Region 3 reports a total now of 73, currently 73 inpatients. That number yesterday was 79, so we had a nice drop in Region 3. Region 3 is 20 counties in Northwest Iowa and is one of 6 regions across the state. So back to the stats. 73 inpatients yesterday, 79 the day before. Of those 73 patients, 41 were in the ICU. The day before, that number was 38. So that's not a good, we had 3 more in the ICU, but we had 6 less in the aggregate. Within the last 24 hours, there has been 1 new COVID-19 case hospitalization in Region 3. The day before, that number was 4. So the rate of hospitalizations in Region 3 are going down, which is good. The number of inpatients is going down, which is good. But the level of ICU care has gone up just a little bit from the day to day. So we will continue to bring this information to you periodically as well. Stepping up now to Iowa, and again to indicate that this thing is not over yet, there's 539 new cases yesterday in Iowa, bringing the total in Iowa to 12,912. Yesterday alone, there were 18 additional deaths in Iowa for a total of 289. So again, this thing isn't over. I would like to talk a little bit briefly here about some of the guidelines that public health is putting out, CHP, but also guidelines from the CDC. And we haven't talked about those specifically lately, so I thought I'd just run down and maybe emphasize the last point. Stay home if you or anyone in your home has symptoms of an illness. And by now, I certainly hope anybody who is symptomatic gets that and understands to stay home, understands to be cautious. And secondarily, if you feel you need to be seen, please call in advance so that we're able to direct you to the right spot and to protect workers here until we get you checked out. Maintain a distance of 6 feet from others. That's been pretty consistent for a long time. Clean your hands, cover your coughs and sneezes, clean and disinfect frequently touched surfaces. And then the last one that I want to point out again is wear a cloth mask if out in public and you cannot maintain 6 feet from others. Again, as I was mentioning the other day, use some grace. Some people are getting in hot water, so to speak, because they're not wearing a mask. Some people are getting in hot water because they are wearing a mask. And the point is, you really don't know what that person is doing. If they're able to stay 6 feet away, less than 10 minutes, maybe a mask is not called for. According to the guidelines, a mask is not called for if you're able to do those things. If you're not or you're uncertain, by all means, you should be wearing a mask. And so that's just a reminder on, a little bit of a reminder on masking. I want to transition a little bit to testing because a great deal of confusion on testing. I even get confused when I watch the national news or even the local news. But I think it's important that you understand we are trying to get rapid testing here in Orange City. Just yesterday, we were denied the ability to do so from the Iowa Department of Public Health because, quote unquote, none were available. And when I say none were available, those would be test kits or the medium. And so we're trying. We are not able to get them from public health. We're trying to go with and source some for-profit labs, but they are pushing us back as well. Don't call me, we'll call you kind of thing. But we are trying to do that, and that will be important. Certainly that's going to be critical, or certainly be nice for our OB patients and for our same-day elective or non-essential or elective surgeries and procedures. I do also want to talk a little bit about our methodology and what's going on with the what we would perceive to be the normal test that you would have, the swabbing. We have two different avenues for that. One is the state hygienic lab, and that is, you're probably more familiar with that they have the criteria established that if a patient does not meet the criteria and we send them the swab anyway, they're not going to do the test, and we've wasted the swab. We've wasted the kit. And so that's why we've been so adamant about meeting criteria, denying those that don't meet the criteria, and applying that screen universally to everyone. We also have a source at Sanford, an ability to test at Sanford. The screening criteria is not quite the same. We're able to do a few more tests there that our clinicians feel are necessary. That will likely be a test where our surgeries our surgery patients go to, because the turnaround we can affect a little bit. But you have those two primary sources, the Sanford connection and then the state hygienic lab. We also have kits in each one of those two areas. And so we have to be careful that we send the state hygienic lab kit to the state and the Sanford kit to Sanford. Within that hierarchy of kits, we keep things, we think about it this way. We want to make sure that we are able to test virtually every resident in the nursing home should we need to do that. And in fact, senior care, Landsmere Ridge as well. But first of all, Prairie Ridge. And so we want to make sure that we have enough baseline kits that we can go to in very, very short notice without asking anybody permission or to get new supplies in, that we can do those. So that's our first priority. And out of our stockpile of kits, we need to make sure the nursing home folks are taken care of. Secondly, we need to make sure we have kits available for those that present clinically. Symptomatic patients that obviously need to be tested, should be tested. We need to make sure we have the kits available for that. Thirdly, then, and in this order, surgeries and OBs, that we need to be able to provide that assurance to the patient, to the caregivers, to the families that those patients are safe and appropriate to do the procedures with. And obviously, if it's an emergency surgery, then we need to make sure that we're doing necessary precautions and things like that as well. So it's important to remember that we have that hierarchy. We're not dealing with hundreds of kits. We're dealing with numbers significantly less than that. We are told that and feel that we are able to resupply these kits kind of in the 25 range. So we're dealing with maybe options of 25 kits at a time. So it gives you a little bit of an idea. We're not dealing with massive numbers here and how closely we need to monitor this. If we start to feel that our supply is too low or we can't address the clinical implications, or that when somebody presents with clinical needs, symptomatic, and the nursing home, then we'll stop doing the surgeries and elective cases. We're also working on getting access to, in a consistent way, IgG testing. Maybe some of you have heard about that. An IgG test really tells you whether you've had exposure to the coronavirus. The problem with many of these tests is that it indicates that you are positive to a coronavirus, not necessarily the coronavirus. And obviously that's the one that we're most concerned about, is the COVID-19 illness. And if somebody has been positive to that, we want to know that. And the theory is then that you would have some immunity. Now, even that is not universally held today. If some of you may have noticed Dr. Rand Paul's exchange yesterday with Dr. Fauci. Dr. Paul was not wearing a mask at this hearing. One of the reasons he was not wearing a mask is that he's had COVID-19 and was relying on the data that he believed, as a physician, that he was immune. That is not universally held. And so what we want to do is be in a position where the level of reasonable assurance is provided to us. So first of all, reasonably assured that you were positive to, that you've had the disease, you're positive on the IgG, so that means that you have had it. And then secondly, the degree to which we can rely on the fact that you are then immune. This is very big, particularly with healthcare workers, particularly in a senior care environment. If we could reduce our level of PPE that we're using in the senior care, it makes it more of a human-to-human kind of experience again. You can actually see people's expressions on their face. I think that's important for our seniors to be able to do that. So this IgG testing is something that we're looking at. We're looking at being able to provide that first and foremost to our staff so that we know who had it, who didn't have it, then to maybe our residents and senior care, and then ultimately to businesses or to the public in general. That's going to be really important as we move into the fall in schools and opening up society again, that people know that they have had exposure, but also that people can rely that they're reasonably assured that that exposure results in some immunity. So lots of information here, lots of different kinds of testing, and I thought it was important that you understand that this is not necessarily always black and white. So I'll just leave that at that for now. Shifting gears a little bit again, remember, as I mentioned in a previous recording, try to focus on what you can control. So control what you can control. There's a lot of frustration that's growing out there. I understand it personally myself. It's growing in me as well. This is going to go on for a while. You hear now things about maybe months of self-isolation continuing, some things like that as we gradually open safely. But by controlling what you can control, you're keeping your mind in the right place. And hopefully at the end of this COVID-19 tunnel, whenever that is, or however long it is, or how you define that, you come out better in terms of maybe one or two less comorbidities, that maybe your blood pressure is better under control, maybe your diabetes is better under control, maybe you've lost some weight, maybe you've reduced the some anti-inflammatories, you produce more anti-inflammatories, that you come out of this healthier, because we all know that the statistics are very clear, and that's that's hard to say in today's environment, something that's very clear. But the fewer other underlying medical conditions you have, the better your chances are of surviving, not only surviving COVID-19, but possibly not even knowing that you had it. And so the healthier we can be in these other areas, the less we may have to worry statistically about the COVID-19 impact in all of our lives down the road. So focus on what you can control what you can control, and get those mammographies, get those colonoscopies, get those wellness visits, and keep tuning up the engine. Governor Reynolds has come out with some new guidelines. We'll sort through those, and we'll be back to you in the future with what they might mean and of what value they might mean, particularly from the health system standpoint. So that's it for today. Again, I would remind you to stay vigilant, stay healthy, and we'll see you next time. Thanks again.